In Ethiopia, 500,000 children under age 5 die every year. Pneumonia, malaria, and diarrhea are the leading causes of death. Many of the Ethiopian children who die live so far from health facilities that their families cannot obtain the care they need. To address this problem, Save the Children introduced community case management in remote villages in Liban district. Save the Children trained case management workers to bring life-saving treatment for childhood infections to households that lack access to health posts. Case management workers are trained to assess, classify, and treat common childhood illnesses using diagnostic flowcharts. Masasa is one of 44 trained community case management workers. He is from Raro. Masasa is used to people coming to his house asking for help, but he also goes out to attend community health days. This is where he first met Tarunesh, who was just over 2 months old. Your narrator is a headquarters health professional. I spend lots of time reading, writing, and worrying about statistics. This is important, but it's quite far removed from the action. As a pediatrician, let me say that the case you're about to see vividly reminded me of the suffering that we are trying to prevent but rarely see. Let me teach you some pediatrics. This infant is, I estimate, about 6 to 12 hours from death. She has all the signs of advanced pneumonia. Her color is gray from lack of oxygen. Her nostrils are flaring wide as she tries to inhale as much air as possible. Her head is bobbing up and down as she uses her neck muscles to try to expand her chest cavity. She's grunting to try to force air into her congested lungs. Her mother had walked 3 hours for a vaccination for Tarunesh. When Masasa scanned the crowd of women and children waiting for vaccination, he noticed that the infant was severely ill. This degree of suffering is almost improper to observe. Personally, I forget now about the 10 million children in the world who die every year and focus on just this one. With each breath, her lower rib cage draws in because the lungs are stiff and heavy like waterlogged sponges. Although she's using all her strength to expand them with air, they do not inflate well, and her lower chest wall collapses instead. Using the community case management protocol, Masasa correctly assessed that Tarunesh had difficulty breathing, was unable to breastfeed, was lethargic, had fast breathing, and had chest indrawing. All signs that he had been trained to identify. He determined that Tarunesh had very severe disease, probably severe pneumonia. This simple act is the climax. This frame beautifully illustrates the partnership between the community case management worker, who holds the spoon, the mother who holds Karunesh's mouth opened, and Tarunesh herself, who just needs to keep on fighting. This picture of a 1-penny tin spoon and 4 cents of medicine can change the history of this infant. It may mark the end of her dying. Hang on, little one. Let's see what happens. Masasa gave the first dose of antibiotic treatment and, according to protocol, referred her to complete the treatment to the nearest health facility, 2 hours' walk away. Knowing that Tarunesh would die without full treatment, Masasa headed out to find her. Without treatment, Tarunesh could have died of pneumonia. Masasa made the mother aware of this danger and motivated her to find treatment. We aim to dramatically increase the scale of our efforts to save more of these children's lives. Can you help?